This image shows a full upper cast with the remaining anterior teeth which will be removed prior to delivering a full upper immediate denture. Notice the outline of where the teeth emerge from the soft tissue, and the outline will be a guide for us to trim the remaining interseptal bone when these come off. Also, you'll notice that we have the well-healed posterior ridges, which are a result of previous surgery, and it presents an ideal case. This is an overview of the same cast. We're beginning to remove the teeth with a rotating burr, one by one, staying within the outline, showing the gingival portion of the tissue. The cast shows a high wall of stone on the anterior land portion, which will block out our view of the remaining undercut area. So at the same time as removing these teeth, we're going to lower that wall so that we will have an accurate reproduction of the undercut area, which will be part of the modification. It must be noted that it's important that we must always maintain the midline in order that we can proceed for our accurate setup. The midline is either grooved in or drawn on the outside of the cast, but it is essential that that midline is constantly preserved. It is not always in line with the labial frenum. The midline is taken from the patient himself or herself in the chair and recorded accordingly as we see it. As we approach the finishing of the removal of the anterior teeth, we followed the outlines previously placed on there so that we now can have a replication of the interseptal bone, which will remain and have to be modified along with the undercut. The overextension of the anterior land area is extraneous, and it should be removed so that it can be fit into a processing flask. Now all of the anteriors have been removed, giving us a replication of the interseptal bone and the undercut existing. We're now ready to modify the bone or modify the stone in order to be prepared for the completion of the setup. By having relieved and lowering the front wall of the land area of the cast, we can now truly appreciate the amount of undercut that we have to deal with. This is a footnote showing an entirely different case, but it does show and reveal what can happen when a case is referred from a surgeon wherein the posterior area was totally neglected, presenting a situation with a severe undercut on the buccal aspect of the tuberosity. This must be removed before this case can be done. This shows the completed modification of the anterior alveolar ridge, also showing the preservation of the midline and the scoring of the post-palatal seal and the butterfly configuration. It's very important to make a duplicate of the modified cast along with a surgical stent. These are then presented to the surgeon to enable him to perform an accurate alveolectomy. The preparation of the post-palatal portion of the cast is shown here as outlined in pencil. Again, we start at the hamular notch on one side, proceeding through the fovea palatina and ending on the hamular notch on the opposite side. We then scrape the stone from the depth of the posterior border to a fine bevel towards the anterior portion, creating a depression in the stone. This will assure and increase the retention of the record base as well as the denture itself. Using a small wax spatula, the widest portion or the widest end of the spatula should be used to scrape a depression into the stone, beginning from the deepest portion of the beading and ending anteriorly as a feather edge, and follow along the butterfly configuration. The posterior teeth have been previously tried in to confirm centric along with confirming the OVD. So the case is now ready to complete by setting up the remaining anterior teeth so that the case can be processed.